Okay, so would you say that individuals with kidney disease, would they have diabetic kidney disease oftentimes, or would they just have kidney disease without diabetes, or would it be mostly a mixture of a bunch of different comorbid conditions all at
Uh,
once?
well, that's a good question. So, in our clinic, because we focus on weight issues, we have a higher percentage of our patients will have diseases like diabetes. So, I tried to think about and pull up numbers. I couldn't come up with exact numbers for you, but approximately 45 to 50% of patients in our clinic would have metabolic syndrome, which is some derangement in glucose metabolism, blood pressure, cholesterol, lipids, things like that. We probably had about 15% in our particular, as a group, 15 to 20% had full blown diabetes. And then of that, a subset would have renal disease. And so I think uh, a lot of the renal disease that we saw in our patients would come from long-term diabetic issues, but we also work very closely with the renal transplant department there at Swedish, and they would have folks not only with diabetes, but then hypertension weighs in as well. That combination, diabetes and hypertension, was a big one. And then they had a lot of folks who had a polycystic kidney disorder of some point and had progressive loss of renal function on a genetic basis through their life, largely. So
Okay,
we had,
interesting.
yeah, it was very fascinating.